Hi everyone, my name is Tavish Pandit and in this OSCE video I will be performing physical examination for eye. So in this video I will be performing the examinations and simultaneously I will be narrating them for you so that the video is brief and informative. Keep watching. Greet the patient and introduce yourself and ask them about their complaint along with previous history. Now start the examination with the visual acuity test. Ask the patient to stand 20 feet from the regular Snell's chart. Always test the right eye first, so ask the patient to cover her left eye first. And ask the patient to read the letters from larger to the smallest. And similarly repeat the examination for the left eye. After the examination, note down the score and start with the Jagger near vision test. And for that we will be giving Jagger's chart where the size of the letters are associated with the inches between the card and the eye. Note down the results and start with external eye examination. Check the eyelids for swelling, masses, eyelid abnormalities, matted eyelashes, redness, discharge, etc. Ask the patient to open the eyes and check the sclera for swelling, redness, discharge, etc. Now it's time for pupil examination to see consensual and direct reflex to rule out any RAPD which signifies problem in the ipsilateral optic nerve. For that, use a light pen source and project the light sideways into the left eye and see for constriction in the left eye and also in the right eye. Similarly, project the light in the right eye sideways and check for the constriction in right eye and also in the left eye. Note down the recordings and also check if briskly reactive or sluggish reactive to light. Now start the physical examination for extraocular muscle movements. For that, ask the patient to watch at your fingertips without moving their head and make a big H. This way you can see the patient's movement of their eyes in all the directions and function of all the extraocular muscles. For the digital tonometry, ask the patient to look down and use the index finger of both of your hands and palpate the superior part of the eyeball by alternatively pressing one index finger at a time, and repeat the examination for the other eye. It is described as soft if the consistency is same as your lips, and it is described as firm if the consistency is of the tip of the nose. For fundoscopy examination, get a fundoscope, and for examining the right eye of the patient, hold the fundoscope in your right eye, stand in the right side of the patient and use your right eye. Ask the patient to look straight towards the wall or through your shoulder, and you yourself hold the fundoscope 10 to 15 degrees laterally from the site of vision. And after observing the red reflex, get close to the patient until you can see the inner structure of the eye. Now look for superior nasal, inferior nasal, then inferior temporal and superior temporal structures. Similarly, repeat these same steps for the left eye of the patient. Hold the fundoscope in your left hand and use your left eye for the examination by standing in the left side of the patient. Do the confrontation testing for ruling out any visual field defects. For that, ask the patient to cover their one eye and look straight into your nose. Flash your fingers on the margins of the visual field and ask the patient how many fingers can they see. Keep changing the number of fingers so that the efficacy of the test is preserved. Now ask the patient to cover their other eye and repeat these same steps and see if the patient can follow the numbers of fingers you are showing. Now these are the findings that we could see in our patient, and this is how it should be recorded. Thanks for watching this video.
Thank you for watching this video and subscribe and like.